Good morning, everyone. My name's Alex Serafini.
And I'm Andrew Warburton.
And today we're representing Retina Technologies. We're a group of first-year medical students from Mount Sinai with backgrounds in business, software, and hardware development that are focused on leveraging emerging technologies, particularly virtual reality, to increase access to vision screening globally. Our story starts with our strategy officer, Aashay Patel. Last year, while doing health screenings on our campus, he came across Maria. Maria was a patient who had a low-income background and didn't frequently get screened for various ailments that she actually had. She came in with diabetic ulcers and several other conditions that actually are very debilitating to the normal person. Now, the thing was that Maria was actually very resilient to these conditions. She was still happy. She came in with her family. She had a support system that was there for her. That was until Aashay detected that she was losing vision in her right eye. And she hadn't realized that before because her left eye was compensating and she hadn't gotten a vision screening. Once Aashay told her this, she became a different person. She automatically started breaking down and actually told us that she'd rather die than lose her sight. That was the only way that she felt that she could really interact with her family. And so this is a problem that we realize seriously needs solving. So we want to introduce our technologies so that she can get screened as early as possible, have access, and then seek the proper care so that she doesn't lose her sight as quickly and she can spend more time with her family and end up enjoying her life. So we're going to talk about why Maria is in this position. Just naturally, about 250,000 people in the US are diagnosed with minimal vision or blindness every year. This ends up causing a huge economic burden of about $30 billion annually in the US. Now, the good side of this is that you can actually prevent 80% of these forms of vision loss if you introduce the proper screening measures. The downside is that in the US, a quarter of the counties actually don't have a vision specialist that can give you quantifiable exams, which is a huge problem. So if we look at why that is, if you are a community health organization and you had limited funding, you would not be able to purchase the several machines you'd need for retinal imaging, the setups you need for visual acuity, or peripheral vision screening, all of which are necessary to get robust testing for vision loss. It can end up costing over $150,000 for one of these small clinics. So instead, you're left with non-quantifiable manual retinal, just looking at someone's retina, and also doing hand motions to detect if someone's losing peripheral vision. These are also not reimbursed specifically for physicians. So what do we want to do? We want to get out with the old. This is an example of a Humphrey visual field analyzer. It's a peripheral vision screening, and this is important for several diseases where you lose vision from the outside to the inside. And so what we see is that it actually has a very outdated computer system. It is also, you also need expensive technicians, and a lot of these technician studies have actually found bias the results of the test depending on their experience. Patients will need to rest their chin, especially elderly patients that have predominantly a lot of vision loss and have comorbid arthritis a lot of the time. They're very uncomfortable, they get fatigued, and this actually leads to inaccurate results as well. And as we spoke about before, this cost is just not reasonable for small clinics. So we want in with the new. We want to bring virtual reality into clinics, particularly for vision screening. We estimate this will be a fraction of the cost for these large machines. It'll also allow patients to have a relaxed sitting position. They'll be able to perform better, not be fatigued. And because of the properties of virtual reality, we can implement several exams that many of you in this room have probably taken before. And because of the state of virtual reality, we can also do further analysis on these results. That means we can end up having automated diagnosis referrals. We can also expedite the tests as well. So we have the ability to customize a lot of these exams. So how would this work for Maria in real life? Imagine Maria comes in to see her community physician. What would happen is she would see a nurse or tech first to get her blood pressure taken. Because we estimate that our entire battery of tests would take 10 minutes or less, she'd be able to have vision screening tests at this point in time too. What this means for Retina Technologies is we would get about $700 flat fee upfront, one-time cost, from that clinic for our headset that has the integrated exams. Now, physicians would want to adopt this technology because this allows them to get a new form of reimbursement that they didn't have before. And that'll come in the form of about $30 per exam based on the codes that currently exist, which for low resource settings is actually quite a lot per patient. And what we would do once we get the data is we would actually be able to provide a refer, non-refer recommendation to vision specialists so that physicians can more accurately send their patients to someone who can treat them. And with all of this provided service, we would be able to have a $3 approximately out of the $30 recurring fee per patient.
Thank you. So how are we going to reach more patients like Maria? We have 3 primary market segments. The first are primary care physicians. They're the gatekeeper to your health. The second are ophthalmologists and optometrists. They're the ones who are actually doing the vision screening. So we want to replace the old and antiquated machines with our new low-profile VR headset. And lastly, we're going to go out to pharmacies. We want to reach as many people as possible, and you can't live more than 10 minutes away from a CVS. So as a global view of our market value, right now our device falls under point of care since we're in the VR medical space. And globally, that's about $25 billion. But we want to start at home right here in North America. And where we are, it's about $830 million market in the ophthalmology space alone. And we hope to grow from there. And here's a bird's eye view of our competitive landscape. What we want to do is we want to implement different segments, such as patient data, VR, and diagnostic hardware, all within our device. A more zoomed-in approach, we can see we have a couple of competitors in this field. But after over 100 interviews through the Combine program, we found that providers, physicians, ophthalmologists want 4 things from devices. They want foveal and peripheral screening, so center field and peripheral field screening. They want the device to be able to be condition-specific, so can you detect cataracts, macular degeneration, glaucoma? And they want the tests to be really quick and to have an auto-referral system. We'll have the fastest algorithm, and we'll also use machine learning to do an auto-referral recommendation for patients. And lastly, of course, for these community clinics, they want it to be portable and affordable. And we are the low-profile alternative to the $150,000 machine conglomerate that you saw earlier. And no other competitor at the time does this. The Tilde shows that they might be able to do this, but we're the only one who fills all 4 of these criteria. Going forward, what we want to do, we're finishing up our time with the Media Lab, which has been wonderful. We're going to go to the Augmented World Expo, which is a huge VR ability, so we hope to demo our MVP, see what that landscape looks like, and we want to further optimize our development and our algorithms. We hope to do pilot studies through New York Eye and Ear, through some private clinics, and some free clinics at Mount Sinai Hospital as well. And hopefully, by 2021, we'll be able to launch our product. We have an amazing mentorship team. We have teams of ophthalmologists, IP specialists, and business experience from Rapt Health and WebMD. These have all been super helpful for focusing, pioneering, and deploying our product. So to bring it all back, what we've learned from this program is that Retina Technology can save money for providers. We can also be used for screening as a screening tool in pharmacies, like a blood pressure cuff. We can allow PCPs to reimburse for new codes. And we can reach more people with teleophthalmology in rural areas. And we can improve patient throughput and satisfaction. So this is really the bottom line. This is the dream that we had when we started this company. If you look at the blue map, this is the current ophthalmology density, the employment density across the United States. Anytime you see light blue, that shows that there are less than 3 ophthalmologists per 100,000 people in those areas. So it's obviously a huge desert in the middle of the country. What we want to do is we want to increase screening access to all people across the country. The green map, as you can see, is employment density for pharmacists across the country. There's a 10-fold increase. In the lightest green area, there's still at least 30 pharmacists per those areas. So with our technology, we'll be able to reach, hopefully, a 10 times increased population for screening and to provide the care they need. And this will help patients like Maria in the future live her normal life. She just wants to see her grandkids again. That's why we're here. We're here to help Maria.